The National Health Department is urging parents to give consent for their daughters to receive the HPV vaccine. Now, the HPV vaccine is administered to girls 9 years and above in primary schools to help prevent infection and protect against the virus that can cause cervical cancer later in life. Now, in South Africa, cervical cancer is not only the second most common cancer after breast cancer. To discuss more on the campaign, I'm joined by the Deputy Health Minister, Dr. Sibongiseni Dhlomo. A very good morning to you, Dr. Dhlomo. Thank you for your time. With cervical cancer being the second most common cancer and number one in causing deaths amongst women in South Africa, perhaps let's start off with a brief overview of what it is and its causes.
Thank you very much, Paul, and thank you also to your viewers. This is year 10. We started this in 2013, where as a department we said maybe we should then err on the side of reducing this what we have eloquently put it as the second highest common cancer amongst women. Now, there has been some scientific evidence that there is a virus that is sitting on the private parts of both men and women, which is called human papilloma virus. And therefore, we are giving a vaccine against that virus because later in life, that virus actually becomes a cause for the cancer of the cervix. So we started this 10 years ago. It's a very unique program that we are very happy about it, that we go to all primary schools in the public sector, grade 5, or what we could call grade 5, standard grade 5 and 9-year-olds. And we vaccinate them against this human papillomavirus vaccine. As I was visiting a school here in Bumbulu today, my visit to go and distribute uniforms coincided with the school health nurses who were there already, because this campaign has started again on the 5th of February and we'll do it both February and March. Very interestingly, this year, because of the scientific evidence again, we used to give 2 vaccines, one in the February-March slot, and then we come back again September, October. But the scientists have told us now that all our girls can actually have 1 vaccine. Hence, we are excited that this year, in September, October, we are going to be vaccinating in private schools and special schools, and therefore expand this, because this is what we have not been doing in the previous years. So we have a 19-year-old girl, South African today, who was vaccinated 10 years ago, who's entering a university. In 10 years' time, when she turns 29, we will have no fear that she will ever have cancer of the cervix. It's a very good story to tell.
What would happen, Dr. Dhlomo, to those who were not vaccinated with the human papillomavirus vaccination, those who may have missed it in primary schools?
We have also since been educated by scientific evidence that we can do a catch-up. We just thought as a South African we start with a 9-year-old at grade 5. Now we have been educated that we can still go right up to age 15, 16. So there will be a plan to even go to grade 8, 9 in high schools and really be able to vaccinate all those, that cohort of 15-year-olds and younger with this, because it is actually now proven that we could also do it at that level. So we are excited that we are going to do it this way, because right now, if at a particular age in our lives we are going to say no more cancer of the cervix of the adult population, it will be because this has had a very good uptake. So the WHO is commending us, but they are saying, South Africa, we are not doing well enough because we are not doing children in the private schools and we are not doing other students in the special schools. So this year is a very exciting year that we are going to be actually vaccinating all learners, both private and public schools. You are correct, Paul. We are requesting parents to then sign for us a consent that says they would actually be giving us a permission for our health nurses when they go to schools to give this dose of a human papillomavirus vaccine.
And in the past, what sort of reaction have you had from parents and guardians as they asked by schools to give this consent? What have been some of the concerns? Perhaps this is a good opportunity to then bust some of the myths around receiving this vaccine.
you would probably recall there's actually been a very positive response from parents. You would recall that sometimes when children go to grade R, we actually ask for the road to health chart. The teachers will want to see that as to how they've done with their vaccinations of the immunizations, be it against polio, measles, chickenpox, and all those. Because then there's a very good program to put and make sure the children are protected. So we have been actually discussing with parents to say this is an add-on to those vaccines and the immunizations that we give to the children, and this one is a special one because it does this. And parents who really have come forward have really signed, and we are very grateful. There have been very few who have not been willing to participate, but over 95% of parents in all our public schools have given us consent at the time we needed it, and all those children have since been vaccinated.
Dr. Dhlomo, for those who are older, what are some of the preventative measures that can be exercised for older people who may have missed this vaccine completely and may not be able to get it?
There is also another guide from the WHO, and we want to request this. Because of other epidemiological changes, we used to know that cancer of the cervix is a disease of older women. Older means postmenopausal women who have stopped menses at the age of 60, suddenly they start bleeding. Now, because of other things, including new diseases in the world, we see as early as 30 years of age, women getting cancer of the cervix. So we want to plead to all South Africans around the age of 29, 30, please try and visit a clinic and request a pap smear. Now, there are other advanced technologies that you are doing, but that is good enough if it is done properly. It can begin to show us, because while we actually are talking about cancer of the cervix, but if it is detected very early, stage 1, stage 2, stage 3, which I'm not going to really bore you with that, we are likely to see success stories. A lot of women do survive if we catch them much early on stage 1, which is still limited to a small lesion on the womb, or maybe has not spread too much outside the pelvis. It really gives us a very good yield and result. So we really request for all our South African women at the age of 30 and above, please make sure once a year you go and request a pap smear. It will go a long way towards really decreasing the impact of this disease in the population.
Very well, Dr. Dhlomo. Thank you so much for your time. Let's leave it there for now. Of course, that call to ensure that one goes to a pap smear, gets a pap smear yearly to really detect any sort of cancers which may be there. And, of course, just for overall health benefits, as well as encouraging parents, guardians to sign those papers allowing children in primary school and those, of course, at a later stage in high school to get access to the HPV vaccine.